at Cardiology Napa Valley, 2017, the ninth year of this conference, which has been a great venue to interface providers, industry, and professional society leadership in a forum to discuss several things, mostly around the clinical care of our patients. I have Dr. Michael Valentine, who is the incoming national president of the American College of Cardiology, with us today. And we're going to talk about some issues relevant, particularly ones that are late breaking as of this morning, related to changes in the new Affordable Care Act repeal and replace effort, something commonly and affectionately known as Trump Care. And we're getting tweets and blasts through our phones this morning. So I wanted to ask Mike from the ACC perspective, since we got a review this morning of the ACC's stand on that, where he thinks we're going over the next several months with the repeal and replace effort.
Or reform.
Or reform.
And so Charlie has brought this up wisely this morning, and we spoke to many of our ACC members this morning. And president of the ACC is Minnow Walsh. And Minnow actually released a statement from the college several weeks ago in response to the House version of Trump Care, or the ACHA. And you know, there are certain principles that our Health Affairs Committee, or which is formerly our Advocacy Committee for the college, has put forward. And at that time, the House version really went against many of our principles of healthcare support, right, which is obviously coverage of our patients, it's quality information, it's savings of money, it's actually protection and, importantly, improving the lives of providers and cardiologists as well. So this morning's version of the Senate has come out and is very similar to the House version. So far, this has not been scored by the CBO, or the Congressional Budget Office. It's not been to the parliamentarian yet. There are questions of certain splits within the Republican
right.
Party, which may make it difficult, with Rand Paul and others who may not support this, Susan Collins. So we don't know what's going to happen here. It's hard to tell what version of this, or any version of this, is going to make it to a vote. And we hopefully will know all this. I know that that Mitch McConnell is trying to bring this forward by July 4th recess.
Sounds aggressive.
It is aggressive, and we think that that's unlikely.
Yeah.
But we hope that any reform of current health care plans will keep our patients in mind, and our physicians and other providers in mind, our APPs, in creating a better quality of care for our patients.
That was it, and that presentation this morning, which was, I thought, great, and the first time I've seen it succinctly on a slide, the principles of the college about which we're trying to at least advocate change. One of the things we didn't talk about, which is I know on everybody's mind, which is we watch this dysfunction in Washington, we watch this impasse on all these conversations around healthcare reform. Obamacare, the previous law, is under scrutiny, and depending on who you listen to, is imploding or going through rapid change. If we don't get anything done over the next few months with a new repeal, replace, or reform, what's going to happen between now and the end of the calendar year?
Well, I think, as you heard this morning, even half of the Republicans are saying reform the current plan that's coming out, and many of the House members are saying reform. So I think at the college, what we do is we look at the principles that we share and that our Health Affairs Committee has published, and we say, meet these principles: better patient care, better coverage for our patients, and yet we also say there's a chance for our members to come together in Washington. And as Charlie, if you've asked me, and Tom Deering asked me this morning, and Jeff Marshall, what happens if nothing happens? Well, this is the perfect opportunity for our members to come together. It doesn't matter whether you're a member of SCI, HRS, we're all cardiologists, we're all members together. And so the ACC has our legislative meeting coming up in September, and it's a great opportunity to speak directly to your congressman face to face and say, this is what we need.
Right.
This is what our patients need. This is what our physicians and APPs and all of our members need. And that's in September. And the Georgia chapter and here the California chapter No two chapters have been better at doing this than yours.
And it's a great opportunity to
And
directly
so if you
interface.
really want to meet with your senator and meet with your House of Representatives, then this is the perfect time, because you will meet with their staff. And the
Yeah.
Georgia chapter has been very successful in meeting
Getting-
with their actual members.
Absolutely.
So it's a perfect opportunity to say, this is what we stand for, this is what we need, why can't you make it happen?
One more question. So, in my current role, outside of being a cardiologist, now with oversight, if you would, over a slate of physicians that are not necessarily specialty oriented, including primary care. One of the things that continues to come up is, and I didn't want to ever use the word again, but MacRA. Where does MacRA stand in regardless of which version of repeal, replace, and reform comes down?
Well, you know, MacRA is essentially CMS payment. So MacRA had nothing to do with Obamacare or the ACA. It has nothing to do with Trump Care or the ACHA. CMS recently released, in fact,
Yep.
just 2 days ago, released the 2018 version of MacRA and MIPS, and we see very little change from the 17 to 18 version going forward, of which payment would be in 2020. The quality parameter was still 60% in MIPS. There is a raise in the floor for small practices, more coverage for small practices of the $30,000 to $90,000 limit. And so we think there's some more protection for these small 2, 3, 4 person groups that we have in our country, especially in California, Florida, places like that. But overall, very little was changed. And so whether it's Trump Care, Obamacare, whatever, this is really completely separate from CMS payment. And the college has a MacRA task force, which is led by Paul Casal, and Paul is the only physician, one of the few physician members actually on the national HHS board. So we have a front row seat.
Yeah.
Cardiologists have a front row seat, and there's nobody more effective or wise about this than Paul Casal. And so he reports directly back to the MacRA task force, and then we can therefore act on it based on this.
Right. Well, it's great to see the college so active. It is one of the best, I think, professional organizations in the country. 52,000 members strong that are really taking strong stances in advocacy and trying to move the ball forward for not only the physicians and the providers, but most importantly for the patients. It's been nice work.
Well, thank you. And we also appreciate our partnerships. All of our sister societies work well with us. And, you know, advocacy is another opportunity to work well together, because when the House of Cardiology speaks, we actually have people that listen.
Yeah, they show up. Well, it's been great having you here at Napa. And anybody else, come next year, you'll hear this kind of conversation. It's great boutique environment with active dialogue between all stakeholders in healthcare. So thank you for joining us.
Thank you.